I am Dr. V.C. Mehta. I am specialized in cataract and refractive procedures. Our eye is like a camera, and this camera has two lenses. The front lens, which is a black part of the eye, which is called as cornea, and the lens inside the eye is called as a crystalline lens. As the age advances, the crystalline lens, for reasons not known, starts becoming opaque and it starts affecting the vision. Once the vision is significantly affected, the only treatment for the cataract is surgical. That means we have to remove this malfunctioning crystalline lens and replace it with an artificial lens. This procedure is called as a cataract surgery. And like everything else, the cataract surgery also has evolved a lot over a period of time. For example, way back when we were doing residency in late 70s, the whole cataract used to be removed. And to remove the whole cataract, which measures around 10 millimeters, an incision of 12 millimeter had to be taken on the black part of the eye. This needed stitches and it needed longer recovery period, long resting period, and then the amount of glasses that would be required after about 30-40 days of healing. All this has changed over a period of time with a single instrument called as a phacoemulsification. From 14 millimeter incision, it has now come to 2 millimeter incision, through which the phaco probe is inserted inside the eye, and the ultrasound that is transmitted cracks the cataract into small pieces and is then aspirated. So, the cataract is emulsified or broken into pieces inside the eye and aspirated. Therefore, it requires a very small 2 millimeter or 2.4 millimeter incision, which does not need any sutures. The recovery period has become very short. In today's cataract surgery, patient can be back to work in a couple of days' time, maybe around 3-4 days' time, and the vision also gets established much faster than in olden days. We now have what is called as robotic cataract surgery, or it is also called as a Femto laser assisted cataract surgery. What it means is that the patient first goes into the laser room where the laser is given, and then what the laser does is that it makes a circular opening, which obviously it can make a very perfect circle, and it cracks the cataract into small pieces. Then the patient comes to the surgeon puts in the phaco machine and it removes all the pieces and implants the lens. There are a lot of myths about the cataracts. It has to be ripened, it has to be done in a winter time, etc. All these were okay in the olden times, but in the modern day techniques, all these are now not necessary. When do you need to undertake a cataract surgery depends on patient's visual needs. If the patient vision starts getting less and less and patient finds it difficult to read or to drive or to identify one colors, then the patient is requiring a cataract surgery. It's not like olden times where that the vision has to come up to the finger counting, only then you get a cataract surgery done. Suppose the patient is wearing thick glasses and the patient has minimal cataract, still a cataract surgery can be done so that the patient gets the advantage of removal of the numbers at the same time improvement in the vision. So there is no season, there is no specific time for a cataract surgery. The call is taken both by the patient and the doctor after thorough examination and taking a history of the visual difficulties and the visual needs. So no need to wait for a cataract to arrive, and no need to go on with a compromised vision for a longer time. In today's time, the cataract surgery has become much simpler.